Good evening, I'm Antonia Singut. Despite huge funding to the country's health sector in the 2016 national budget, the problem of inadequate drugs, limited accessibility of healthcare services, healthcare workers and others still remains a huge challenge, particularly in rural PNG. A healthcare review report conducted by the Special Parliamentary Committee on Public Sector Reform and Service Delivery reveals that these problems are ongoing. Committee Chairman Bira Kimisopa told the media that such reports contradict the government's policy in priority areas such as healthcare, education and law and order. Rose Amos reports.
With the ending down of the country's national budget recently, the question as to whether these monies reach their intended purposes remains. A healthcare review report conducted by Special Parliamentary Committee on Public Sector Reform and Service Delivery reveals that despite huge funding to the country's health sector, the problem of inadequate drugs, limited accessibility of healthcare services, healthcare workers and others still remains a huge challenge, particularly in rural areas. The findings also reveals these health issues is due to lack of proper management in the health sector, long and complicated bureaucratic processes and policy confusions are among major contributing factors to the poor health care services in the country.
It's a problem that's widespread, and that starts with procurement right down to basic delivery, and also chronic management issues. Dealing with the boards, and also dealing with just simple management, day-to-day operations of the health.
The report, however, recommends government, when providing fundings, must also ensure its management is effective, cut down on long, complicated bureaucratic processes, and make regular follow-ups to ensure the funding reach its purpose.
These are issues which the committee felt that needed a lot more intervention from government and a lot more intervention through the bureaucracy.
The report was supposed to be tabled in Parliament in the last sitting. However, the House has been adjourned earlier than expected. Nevertheless, the committee will conduct an inquiry with the health sector next week. Meanwhile, the health sector received the third biggest chunk of the 2016 national budget with a total 1.5 billion kina. Rose Amos, NBC National News, Port Moresby.